For years, the man in charge of WA's COVID response managed to dodge the virus himself until a couple of weeks ago.
I'd managed to go for nearly 4 years without getting it.
Now recovered, Dr. Andy Robertson says he's far from alone. WA's about 10 weeks into another wave of infection, which could be worse than the last two.
Look, I expect it will track upwards a bit further. It is always hard to predict where it will end up.
But he isn't forecasting disaster or new restrictions, with hospitals coping well despite the spike. As for the broader community, the picture's less clear. Last month, WA Health shut down its website where people could self-report a positive rat. There's also a warning rats risk becoming less reliable if the tech doesn't keep pace with new variants.
You'd have to probably test yourself 3-4 times before you got a positive answer.
WA Health says it's confident that rats remain a robust way to test, but a positive result might not show up for the first day or two. So people should stay home from work and events as soon as they develop symptoms, and they should stay home for at least 5 days.
Even if you're feeling better towards the end of it, it takes generally 4 or 5 days before you've cleared the virus and become less of an infectious risk.
COVID can have serious long-term effects, regardless of a patient's age or the severity of infection. For Professor Nicholson, long COVID left him with diabetes and a heart injury.
But you don't get complacent about those other things, do you? So why should you be complacent about something that can cause some of the worst illnesses in our society?
People are urged to check they're up to date with vaccinations, with fewer than 1 in 10 WA adults having a booster in the past 6 months. James Carmody, ABC News.